With some insight into this, joining us is John Dickerson, our chief Washington correspondent and the anchor that faced the nation. John, we just saw the people's concerns about pre-existing conditions. That's just one of the landmines going forward as this goes to the Senate.
That's exactly right. There are a number of Senate Republicans who think the House legislation weakens or removes just too many of those Obamacare protections on items like pre-existing conditions and also on some of the guarantees that were a part of the Affordable Care Act that certain health benefits would be covered. Also, Medicaid might shrink too much under it. And if that skepticism kills the bill, then the House Republican members will be stuck having voted for an unpopular piece of legislation.
John, the nonpartisan Congressional Budget Office analyzes these bills to tell the senators and congressmen how they'll affect the American people. Last month, when this came up, the Congressional Budget Office said it would cost 24 million Americans their insurance. This time, the Republicans didn't wait for the CBO report.
And they didn't wait because the report was likely to be nearly as bad or perhaps even worse. But regardless, the number was not going to be a good one that they were going to get in terms of that coverage, because they argue the Congressional Budget Office doesn't see health care the way they do, that they argue the reason those numbers are high is under Obamacare, people were forced to buy insurance. The Republican plan doesn't do that, but they think people will get insurance nevertheless and the costs will go down. But they didn't want a number that would look bad as they're trying to build momentum, showing Republicans coming together and use that momentum to get the Senate to overcome its obstacles to passing health care legislation.
John Dickerson, chief Washington correspondent and anchor of Face the Nation. Thanks, John.